Johnny Miro, and another important topic of interest for you today. And joining us will be another great member of Grassroots Institute of Hawaii. And the topic will be Certificate of Need laws. Certificate of Need laws. Now, Hawaii's healthcare system is not in the best of shape. According to some analysts, it's because of the state's so-called Medical Certificate of Need laws, or CON laws, C-O-N, which often prevent new hospitals or other medical facilities and services from being built or being offered in Hawaii. Now, they say these CON laws are partly why Hawaii has a major shortage of medical personnel, because fewer hospitals means fewer hospital staff, such as doctors and nurses. In addition, fewer medical facilities means less healthcare access for Hawaii residents. And when you can get the healthcare you need, it tends to be more expensive and of lower quality, according to the analysts. All right, so here to talk with us this morning about this important topic and what maybe we can do about it is Malia Hill, Policy Director of the Grassroots Institute of Hawaii. Good Sunday morning to you, Malia. How you doing?
Doing well, thank you.
All right, first question for you with this topic, which is the Certificate of Need laws. We all know that there are issues here in the state of Hawaii with healthcare access and enough doctors and facilities. So what is it, Malia, that stops someone from just deciding to build a new hospital or medical clinic?
Yeah, you would think that, someone just decides that, hey, we need a hospital here or a dialysis facility or a clinic or anything like that. And they just, get investment and pick out the land and get the doctors and everyone's happy about it. So, why isn't that enough? Unfortunately, there is an extra step you have to take. You have to get approval from the state to build or even just change a medical service. And that's because of the existence of these Certificate of Need laws, these CON laws. So, to put it simply, if you want to offer a new healthcare service in Hawaii, or even if you're just trying to change things a little, like getting a new MRI machine for your hospital or changing the number of acute care beds you have to file an application with the Department of Health, which then goes through this process where they look at the situation, investigate, and decide whether or not to grant you this Certificate of Need that lets you go ahead and, build this hospital or offer this service. If you get the Certificate of Need, you can move forward. If they deny it, then that's just it. You can't have that new facility.
All right, what's the history behind these laws? Why does Hawaii require new healthcare facilities to go through this process?
These laws actually come from about the 1970s or so, which, that should just tell you what you need to know right there, because that was a very different healthcare system that we were under at that time. And back then there was this idea that somehow CON laws would help keep healthcare more affordable or prevent duplication of services, which they thought might be a problem. So the federal government pushed states to adopt CON laws, and nearly every single one of them did. But then by the 1980s, they were already seeing evidence that the laws didn't really do what they wanted them to do. They don't keep costs down. They don't have better access or better care. So states started to repeal and reform them. Defenders of these CON laws, they'll say, well, this is what you need. You need these laws. They keep costs down. They guarantee that there's no duplication of services that would end up depriving an area of some kind of needed medical facility. Like if there's two substance abuse treatment centers in a town, maybe they would drive each other out of business and then there wouldn't be anywhere to get treatment. That's sort of the argument behind it.
Sounds like competition. Nonetheless, Malia Hill, Policy Director with Grassroots Institute of Hawaii, joining us this morning. So, like I said, this seems like it's designed to prevent competition between medical facilities. Is that a fair characterization?
Yeah, that's pretty much exactly what it is. It shouldn't surprise you to hear that some of the biggest supporters of CON laws are existing companies that would have to compete with new arrivals. And, to make it even worse, during that application process for your Certificate of Need, potential competitors are actually allowed to kind of weigh in, submit testimony on a CON application, basically saying, hey, this area doesn't need another hospice or dialysis center or whatever. It's a lot like if you were trying to open a new coffee shop in your neighborhood, but had to get the government's permission to do that, and then the Starbucks down the street could come and testify to the government and say, no, we've fulfilled all the coffee needs in this area, and they don't need another coffee shop.
Well, thank goodness that's not the case. But have any proposed healthcare facilities been denied, or is the process more of a kind of a rubber stamp?
Yeah, that's interesting because when you ask a supporter of con laws about it, they'll point out that the Hawaii Department of Health approves almost every single con application. And that's true, but that's not really the whole story. First, they do deny con applications from time to time. In the last 2 years, Department of Health has denied permission for hospice services in Wailuku and Honolulu. They've denied the expansion of surface ambulance services on Oahu, Maui, and Hawaii, and they denied home health agency services in Honolulu. So there are people getting denied. But even more than that, the laws are very broad, so a lot of these applications are just these little manini things, these administrative issues, moving beds, acquiring a new facility that, changing hands of the business, that kind of thing, getting a new x-ray machine. And then you have to consider the extent to which this whole process, which can be expensive and can take a long time, just sort of has a chilling effect, discourages people from even trying to apply for a con.
Okay. As Johnny Merrill, I'm talking with the Policy Director of Grassroots Institute of Hawaii, Malia Hill. And how strict are our con laws here compared to other states?
Well, I hate to be the person who's always doing this because every time you stack Hawaii up to other states, it always seems like bad news. And it's bad news again. Hawaii has the strictest certificate of need regime in the whole country.
Really?
You need a certificate of need for about 28 different services in Hawaii. And I'm not just talking about, obvious things like a new hospital, but, new equipment like an MRI scanner or x-rays, even just changing your beds from long-term to acute care, obviously needing new beds, ambulances, home health, obstetrics, burn care, organ transplants. All those things require a certificate of need under Hawaii law, and it's kind of very weird when you think about it. If the idea is that this is preventing duplication, as though, there's all these people just trying to open burn centers and organ transplant facilities on a whim and trying to compete with each other.
I mean, you're going through all this, and there's got to be some kind of an effect. So what does the research say about the effects of con laws? Do they help keep health care from getting too expensive or ensure better health care for patients?
It's interesting because there is actually a lot of good research on this, and that's partially because about a third of the states have now repealed or significantly reformed their con laws. So researchers have a lot of ability to look at, what happens in states that still have certificate of need, what happens in states that have changed it. And there have been enough research that there's about 400 different tests of the effect of con laws on healthcare cost, access, and quality. And near most of those, research basically says that it has a negative effect on all three of those things. So,
and we're continuing to do it.
Yeah, and we're continuing to do it. So, 65% of the studies say that, certificate of need is associated with higher spending per service. 79% of the studies say that con laws are associated with lower availability of services. And about half of them even find this relationship between certificate of need laws and lower quality care. And, what lower quality care is in this case, how do you measure that? That's things like higher mortality rates after heart attacks, lower patient ratings, greater use of restraints in nursing homes, all that kind of stuff. That's how you sort of see how quality of care is affected by certificate of need.
I can hear listeners scratching their head going, if this data is so critical of con laws, who is defending them and why, Malia?
Well, I hate to do this, but I guess the answer is you follow the money. The biggest support for con laws tends to come within the industry.
Simple as that.
You have the people. Simple as that.
Yes, simple as that. Simple as that.
Yeah. The people who are protected from competition from con laws, they're the ones who want to keep them. So that's who you end up fighting with when you want to reform con laws. Would
you say there's a powerful lobby? That's
well, in Hawaii,
does your research indicate that?
But if you talk to, for example, South Carolina just did a pretty substantial reform of their con laws, and Florida has done it in these states where they really take a serious look at it and they start seriously reforming it. They tend to get very heavy lobbying pressure, especially from hospitals and hospices to keep those con laws in place to protect that business's interest in a lack of competition.
So have they been successful, though, despite the pushback from repealing their con laws other states?
Yeah, I mean, that lobby is a strong lobby, and to sympathize to some degree with the politicians who are faced with this situation. You're a politician, you're looking at this regulation about healthcare, it's complicated, and you have, this research and, people like the Grassroots Institute out there going, look, it doesn't work. It's all this research says it doesn't work. But then you have this group that's representing doctors going, if you don't keep them, terrible things will happen to healthcare in your state. And so that worries politicians, understandably. And that's why it tends to be a very big fight when you come to reforming con laws, because, no one wants to endanger vulnerable populations or anything like that, and that's what they're being told might happen. That isn't what happens according to the data, and more data starts to support that. But, as states have examined it, that's sort of what the fight turns out to be.
So, Malia, what can Hawaii do to reform its con laws? Is there any path forward in that?
Well, there is a lot that we can do here, and I think, just to take a quick tangent and say that I think it's worth looking at the Mercatus Center, which is a think tank. They did a state-by-state study to sort of estimate what would be the effect of con laws in your state. What would it be like if you didn't have any? And when they did Hawaii, they estimated that Hawaii would have 11 more hospitals, including 4 more rural hospitals, 2 more ambulatory surgical centers. Per capita healthcare spending would be reduced by about $219 a year. Post-surgery complications would go down. Fewer people would have to travel for out-of-county imaging scans, your MRIs, that kind of thing, CAT scans. So there is a reason, beyond just, this seems inconvenient and such. There's measurable results, so that's why it's worth having this conversation, which, to answer your question about reform, a lot of the talk when you talk about studies is, what if there were no con laws at all? But you don't only have to talk about it in terms of repeal. There are things you can do that are short of total repeal. For example, you can raise the threshold for certificate of needs, raise the money threshold, because, should you really have to go through this whole process if you're only spending, a couple $1,000s or on bed changes or, some small bit of equipment? And I think it's also worth examining the possibility of removing the certificate of need requirements for services that treat vulnerable patients, like substance abuse centers and psychiatric services, or, the kinds of things where there's just no chance, it's silly to worry about duplication, where there's low-cost alternatives, things like home health care, hospice care, neonatal intensive care, burn care. I mentioned earlier, like the idea that somehow we're just going to have too many burn centers is a very strange way of looking at it. No one's trying to set up a burn center where there's no reason to have a burn center.
Yeah.
And we could also just clean up the process of it. We could prevent competitors from intervening, and testifying against the con application. We could maybe say, hey, you can't consider duplication as a reason to deny a certificate of need. And we could even phase out, some certificate of needs if people are, too worried. What happens if we get rid of the certificate of need? Well, why don't you just sort of phase it out over time and see how it goes?
Mm-hmm. And when you said there could be potentially 11 new hospitals here, did they pinpoint that for specific islands, or just were they thinking about Oahu? And which islands are more affected by these con laws? Did your research indicate that? Which island?
It's interesting. Yeah, the Mercatus study, actually, I suspect that, because they're looking at it compared to, they're looking at effects on other states, and Hawaii has very specific geographical considerations. I will say that, technically speaking, all the neighbor islands are considered rural when they do these kind of classifications. So when they say Hawaii would have 11 more hospitals, 4 of which would be rural hospitals, they're basically saying, 7 more hospitals on Oahu, probably 4 more hospitals spread through the other islands. And that's just sort of a guess based on what they saw in other states.
Mm-hmm.
And what constitutes, as you know, like it's even a bigger impact in terms of rural care in Hawaii than it is even in some states. Maybe we'd be more akin to one of those states where it's very big and there's like fairly significant travel between, people in rural areas and trying to get health care in a city center, because I feel like we're more analogous to that. But they did find that certificate of need is especially difficult for these vulnerable populations, these rural healthcare and healthcare for minorities. Both of those improve a lot without certificate of need in place.
Hmm. Well, you've covered a lot. Anything you missed or need to just remind folks again on the certificate of need laws that we covered this morning, Malia?
Yeah, I think the thing to remember is that it's one of those things that it sounds, like it's trying to do something good, but when you drill down to it, why is the state deciding what we need? Who should really be deciding what we need when it comes to health care? It should be us, the public. And, this worry that competition somehow will result in worse healthcare service it's not borne out by the research. People would like to, defenders of certificate of need will say, healthcare is not like anything else that's offered for money anywhere in the world. But the research shows you, no, even in healthcare, competition is good for the patient. It means lower costs, more services, and better care. And so, I don't think we need to be afraid to revisit Hawaii's really strict certificate of need laws and ask ourselves, what can we do to just sort of loosen these grip a little bit, make these more reasonable?
Summing it up nicely this Sunday morning, Policy Director of Grassroot Institute of Hawaii, Malia Hill. You can find her work in the other papers of the other members of Grassroot Institute at grassrootinstitute.org, grassrootinstitute.org. That's with a T, no S, right? grassrootinstitute.org. Malia, it's been a pleasure as usual. Hope to talk to you soon. Enjoy the rest of your weekend.
Thank you. Happy Sunday to you.